unaware of the sequence,
Mm-hmm.
then you are placing exercises into categories of, a muscle group or a
That's right.
function.
That's
And
right.
fundamentally, the exercises should be placed in the developmental sequence
That's right.
understanding. So when
There
you don't
is.
do it like that, we can say, all right, where we
Yeah,
all acknowledge we're not using the
that's right.
developmental sequence, we're going to do this other thing. But if you don't
Mm-hmm.
even know the developmental sequence,
That's right.
then that's
You are
obviously
out.
that's the
Yeah, you're
fundamental
up
problem.
Schitt's Creek without a paddle. Yeah, that's right. So, so that is this is very. I think this is very important, and it is with that in mind that we must expand the knowledge and the assessment ability, because, as you know, DNS can't tell you if you have a torn meniscus. That's
Right.
not its job. Yes, DNS will tell you something's wrong. DNS might tell you there's something wrong with the knee from how you see it perform, but it doesn't do the diagnostic testing. So you have to draw in resources from all over and be willing to blend them into a goulash that is worthy of your time and that of the patients. Yeah. So it has been, I think it is more interesting now to practice than it was when I was younger. It's much
Well,
more
I can
fun.
imagine. Yeah, I
Yeah.
can imagine because I mean, it's kind of the cliche of like, you know, you. I mean, when I was in chiropractic school and maybe second year, third year, it's like, oh my
Mm.
God, I know everything. I know all this. I know this. I know this, and you don't realize what you don't know. And eh, I think, what is it? I mean, you might have been in practice for 30 years, 35 years
Yes.
at this point.
Yes.
You've accumulated enough clinical knowledge and experience to where you are starting, you've expanded it out so far that you do actually know a lot at this point.
Mm.
And even though you might not know everything, you know a lot more, and you have put it into a perspective and a context that that works. That's actually a good rational framework for the
Mm-hmm.
exam. And you came to the conclusion also that it isn't about the techniques; it's about the exam. Uh,
That's right.
so then once you realize that, again, it's no longer the category error of I need to learn the techniques are the primary
That's
importance.
right.
It's the examination that's the primary importance. And now, because I know all this stuff, I can put together an examination procedure that encompasses all this stuff. And
Mm.
because I'm basing it in DNS or a neurocentric framework,
Yeah.
that's also the right answer. So
Mm-hmm.
it's like you've got
Yeah.
all the right categories now. You're
Mm-hmm. Mm-hmm.
the category of everything should be neurocentric. The
Mm-hmm.
category of all movement and stabilization needs to start from development. The category of, in one sense, the most important thing in clinical practice is the assessment and not the
Mm-hmm.
techniques that you're using. So
Mm-hmm.
it's all lined up for you. I
Mm.
mean,
Yeah,
it's all
I'm
lined up
trying to
now.
make it line up, because otherwise it is a very stressful thing to do, to treat patients, and that it was for many years. And
Yeah.
it still is, but it is
Mhm.
stressful in a different way. I go into the clinic aware of not aware that I don't know what I don't know, and
Mhm.
that from that point I can start experimenting because I have nothing to lose. Whereas before, you were trying to use what you know to drive the assessment, and if it didn't fit, you kind of ran into a dead end. You were like, well, I don't know what more to do. But now you can go, oh, well, let us try knowing
Yeah.
these principles. Let me try the next thing. Let me invent a test that will give me some answer. And I can read the body's response so quickly and so straightforward, in such a straightforward fashion that I can go, well, that test did not work. Fine.
Right.
We move on. And I don't have to prove the test right. I have to prove that it is effective in showing me a difference. and it has to be in the subject of one. It's nice if it's in the subject across the board. But I have my test patient right there. That's the person I have to deal with. And so I have to use his or her baselines to confirm the veracity or usefulness of the test. And then if I do it enough times, I go, wow, this is a test that goes across the board. It is a better test than no test at all. And it is starting to show its efficacy across several patients. And therefore, it is becoming a reliable test to do. Given these circumstances or given this type of patient, you know, if you don't have a nerve impingement, then doing a stretch on a nerve that is fine does not give you an answer that is of great usefulness. It'll just come out negative. Yeah. Mm-hmm. So a test is applicable in certain situations, and in others it is not useful at all. And that is why.
Well, it goes both ways too. I mean, because if you're thinking it's a nerve and you do the test and it comes out negative,
that's right. It helps you. That's right. But what I'm also saying is that you can't throw every test at everybody, because you should look at the symptoms, and those symptoms will tell you what the syndrome is, and it will tell you what the systems are likely to be. And the test will grow out of the system tests, not just a random bucket of tests that you're just throwing at people, hoping that some will stick, some will not.
Right. It's not, I mean, in a sense, it's not you have an elbow complaint, I'm going to open the textbook for elbow and just go.
Elbow, yeah, that's right. Levitt had warned us about that years ago. So I don't know how many warnings one needs to avoid making that mistake. So it is, when somebody tells you something and they tell you from experience, you should just kind of believe them until it's proved wrong.
If their last name is Levitt.
Yeah, particularly so. Oh, please. No.
If you enjoyed this conversation and want to hear more like it, then please like this video and subscribe to our channel. You can also stay up to date on our latest seminars on our social media pages on Instagram and Facebook @IMTR Seminars.